Katekuru osbini mkuru Wambarabu amushemboro magongera harane na magwatero irio yo media a pangine ndohotora a polisi na mushema magongera yeskundino yonena kandi mukundu arushe ohandikara du viteu pana hongo shande amokaro murashi shonda ya kombanda konjeo shirongo kuka konjele manguru ko jana Libya ondanu kwa darate mokarongo monda pitira mokarongo okuya mwangora oge arushe shande yako karongo handikara ndu vite kwa hongo tedi mburukwa ethimboñoka mokatiku siku kengura chahuya tatume kwa darate tuka mwangora ndaharao okupandura aetipo inyano matumarakagao manene ochinyando achimwe shotango otachihokorora okatogotogo etumarakenene njo shotori taturire manguruko kwari natwara chike natwara okatogotogo gerokari okine etimbondia umurashike okatongo keno kukara okana wapaife gere otakabilirwa amubono yena obuto HIV AIDS tangu nene shomweta etumwana kanjono yakora nandime gera kutekeshe umwe koritambako no sho okatongo kena chamo mikiti kakare kamona eshuriro kan pandurao ungudu la polisi pochimanga chao so dubu a polisi taita no ya kadigo chinyandwa ndatari kembairi motenda mu pahendaringa kutara hinjenga hayo ya mwini bori akao pongo eri matai rogeki zamba etumigire ochinyanda eshuku enene zirimo ochinyanda chao chimacha upyaka zirigire chimacha upyaka zirigire kokata opuna antu oyenji naga ndiachi yasa komkitigo shoya rombero kengere kikuchana yeke shomiki nocho ezimbandilimwen jokalirimo yao yokunkonga yokuthipa kochimariwa maupachiwa natukareni twakotokereni nambio nandikandreo katekurumku kochepa kochoesho no chare kwa udokta diskaya amtenye showe tupena na ehokoro kuja omkitinguno owende gini uye pakatindate atande sukumwe nochikopio kuja omitido tunapaife ihatutiwe odokurere peka hatuke omiti okupanga medio okupanga obuto yo HIV medio okupanga onkiti wa AIDS. E fatururo nenge e popio kutia okurere peka shono ochindi na achike chopauna. It's a scientific concept. Chibashike shono tachiningwa kombinga yom moruku gona ena omputo yo HIV AIDS. Operuka. Akatu utara ko ngashito mtu ena ombizera haingo keshe esikuta utme komitize opo ombizie ikare ilipo tatu jona ya kumjua. Pangero nosotros un ministry waniga en kabadara vishe opo kare wa patera apachuana chinacha no korere ndari ko kudengon sindo ochinimachimu kucha u korere oene itau kongwa shike mi pangero mo klinika nosotros u korere otatu tameke okuningira mo magumboge o mai humba tonge kucha tatu chike otatu chike tatu ninga gamithi tatu shilinga gamithi tatu nuni o alkoholi haturi tu unatafundiwa nosotros okay na tukare ni wo patarako ochinimashono kuchota semana chokukerera okukerera okubure okupanga okukerera kakuno ndiro chimashiko kupanga okuno ndiro mopaife otuna irongizo aishe agwanapo noyo kukerera noyo kupanga na tui utheni kumarombero yoteni utani dimburuka na wa ethimbodia twari tuna omkethi wa COVID-19 waru wetu de gashiri chimashiki otwari tui mangeri kumwe no mwari umwe yusa kumarombero gono takara hakumurombero sikakwari hakugongara wangahi hakugongara ni paito dere omoro irongero kumwe yeteni na pachuwa otwaki asugo kompatu jono omkethi COVID-19 idengamo mochilongo chana miti no AIDS atubruo okuirongamo gashiparongomo COVID-19 mopaise kadika tameka nokuresha ochikoki wachaji kuchana nikiwa shirimo chingirisa chimwashike kodima upunangu teke ya echiture moshimbano directors of proceedings. A week before last, I inaugurated the new negative pressure mobile isolation facility at Otapi District Hospital and a new primary health care clinic at Oshkurufiti here in Omsai. On the 13th of December 2024, I officiated at the national event in Rundu that commemorated the World AIDS Day 2024. Today, we are here at Ondobe Humba Center to commemorate World AIDS Day here in Omsai. I am therefore delighted to see all of you coming to commemorate this important day as we reflect on the journey we have traveled in combating HIV/AIDS epidemic in our country over the years. Today, we pay homage to our fellow citizens who have died from this disease over the years. We acknowledge the thousands of health workers who have provided care to those who are sick. We remember the community members, the volunteers, support groups, and families who confronted this disease with commitment and resilience. We recall the invaluable contributions and support from our development cooperating partners, which complemented our efforts to break the backbone of what was at some point a fearful disease. With all these efforts, we now stand at the cusp of ending AIDS as a public health threat by the year 2030. We stand with men and women, boys and girls who are currently living with HIV, and we encourage them not to give up, but to continue taking their medications and continue to live a productive life. Namibia has made great progress in the fight against HIV and AIDS. We remain committed to ensure that all Namibian citizens in all parts of the country who need HIV services have access to the whole range of intervention provided by the government free of charge. You are informed, even right here in Kondombe of you can get those services. The Regional Director for Health and Social Services has informed you about that mobile truck here in Kondombe Center. You can get the HIV services. The global theme for the World AIDS Day 2024 is Take the Right Path. And supplementing the global theme, Namibia has placed emphasis on prioritizing mental wellness as our sub-theme
here in my video.
The aim is to focus on mental health and wellness as part and parcel of providing health care overall, including HIV/AIDS programs and
I've seen that yellow line.
anyone can encounter mental health challenges at some point. And studies have shown that people living with HIV are twice as likely to experience mental health issues such as depression, anxiety, and harmful use of substances. This affects individuals' ability to seek care or to adhere to treatment.
That the video is balanced.
The Global AIDS Strategy for 2021-2026 identified the integration of mental health and psychosocial support within HIV services as a key priority to promote a holistic care. This aims to address both mental health needs and physical health to reduce stigma and improving treatment adherence for people living with HIV. In 2023, that's last year, there were approximately 230,000 people living with HIV in Namibia. Statistics show an HIV prevalence rate of 9.7% among the adults in the age group of 15 to 49 years. Nationally, the HIV prevalence is higher among women at 12.7% compared to men at 6.6%. The interventions we are implementing are having notable impact. According to the statistics, 93% of persons living with HIV in Namibia have been tested and know their HIV status. And of those, 95% of those who know their status, they have been put on antiretroviral treatment, which is provided free of charge by the government. And those who are on ARVs, 98% of them are virally suppressed. which means that the level of the virus is so low that is not being detected by conventional diagnostic tool, and which also means that that particular individual whose viral load is detected is unable to transmit the infection to another person. It is, however, a matter of great concern that despite the progress made, some children of the age group of 0 to 4 years, adolescents, and and young adults, men, and other priority populations are still lagging behind in accessing
if the person is on the
The ministry is implementing the HIV combination prevention strategy that combines methods such as antiretroviral therapy to suppress the viral load in persons living with HIV, distribution and promotion of the use of condoms, provision of pre-exposure prophylaxis,
What is that?
provision of post-exposure prophylaxis, voluntary medical circumcision, as well as behavioral change interventions such as
What's that one?
HIV testing and
Not hear
counseling,
very well.
education campaign, and
Proportional
interventions that reduces stigma and discrimination. The inspiration statement by the lady who spoke about her journey with HIV is encouraging, and I believe that all of us have taken that statement to heart. Our commitment to mental wellness as part of HIV care focuses on key components including access to services, reduction of stigma, strengthening support network, and integrated care. I reaffirm the ministry and government's unwavering commitment to ending HIV/AIDS epidemic as a public health threat by the year 2030. Director of Proceedings. As much as we are talking today about HIV/AIDS pandemic, there are other public health threats that we also have to guard against. These include tuberculosis, malaria, hypertension, diabetes, and cardiovascular disease. We are entering a malaria season, and statistics are already showing us that there is an upsurge in the number of malaria cases. Malaria can be prevented. Malaria can be cured. Let us take heed of the messages which we are receiving from the Ministry of Health and Social Services in order to prevent ourselves from mosquito bites. The responsibility for control of malaria lies with the government as much as it lies with individuals. Individuals must be empowered to ensure they do not expose themselves to mosquito bites, because it is only through the mosquito bites that one can get malaria. And if we prevent ourselves from being the victims of mosquito bites, then we will be in a position to control malaria. There are also outbreaks of serial diseases like mpox, hemorrhagic disease, and cholera on the continent that can easily spill over into Namibia. Therefore, we must be prepared to manage this disease, and we must be prepared to prevent them. Directors of Proceedings. As I move towards closure, I extend my deepest gratitude to everyone who made this event possible. You have once again shown that by working together, we can strengthen and revitalize our public health system and achieve the goals we have set for ourselves. To those who send their messages either through the drama, through performances, or by way of words, I can assure you that those messages have been duly received and internalized. As we depart from here, let us do so with a greater sense of purpose, a deeper sense of mission, and an unshakable resolve that victory over AIDS, victory over hepatitis B, victory over TB and malaria are within our reach. Thank you all for coming here today and making the World AIDS 2024 a huge success. And thank you very much for the organizers, and thank you for the kind invitation. I will now ask the regional director, Tadi Kindra de Proife, Umuriki Winjoro, much corporation, Ature Hapudin Bapoti Mochin Grisa, Mochin Ban. Thank you.
Ay, tikameni. Shashia mo tangko sanuguri ondigoro. Natango. Tahu tak? Okay, ikut banyak hari ke? Masing-masing sini.